Hello again. Welcome back to next episode in MedSynapse podcast. Today we'll have a different topic related to women health. Let's introduce our partner today, Dr. Mohamed Adel. He is gynecology and obstetric doctor. Thank you, Dr. Mohamed, for being here today.
Thank you, Dan.
Okay, let's start our journey across vaginal infection. First of all, I need to know, is there any normal vaginal discharge?
Okay, to talk about vaginal discharge, we must know that vaginal discharge or vaginal secretion is totally normal. It's called also recurrent. It's fluid, usually clear, whitish, or off-white. It comes from vagina. Its function is to keep the reproductive system secured. Glands in the vagina and uterus and cervix produce fluid throughout the day that carries away dead cell and bacteria, which is the stuff you may be seen in the underwear of any woman from time to time. This keeps the vagina clean and help prevent infection. So yes, vaginal secretion is totally normal.
Okay, perfect. Currently, if you can explain us the differences between normal and abnormal vaginal discharge.
First of all, vaginal secretion, its color normally clear, milky white, or as we said, off-white. Its smell is slightly odor, but maybe present slight odor, but not strong or not unpleasant smell. Its consistency is normal, watery, slightly sticky to thick, but normally it's controlled by hormones, and hormonal changes the consistency of it, but it still come from watery to sticky little. Its amount also have multiple factors can change it, like pregnancy, using contraceptive during the ovulation. It may be increased amount, but at all, it's all normal. When we get gray, green, dark yellow, brown discharge, it indicates an infection. When we get fishy or foul smell, it indicates also infection. Sudden change of the amount and increasing it means also something wrong or maybe infection.
Okay, so Dr. Mohamed, what are the most common types of vaginal infection?
We can put the vaginal infection into non-sexually transmitted infection, which is bacterial vaginosis and yeast infection, candida, and sexually transmitted infection like chlamydia, gonorrhea, trichomonas, which is protozoa or parasite by Trichomonas vaginalis. We also have atrophic vaginitis. It's not exactly an infection, but it increases the change of developing vaginal infection and UTIs.
So, Dr. Mohamed, what are the most symptoms that may be common for all vaginal infection? I know it depends on the pathogen or main cause, but there are maybe some common symptoms. So, explain what are the some common symptoms for them.
Okay, vaginal infection don't always cause noticeable symptoms. But if we will talk about common symptoms, we will look like vaginal itching and burning, vaginal soreness, discomfort, maybe inflamed, flushed, swollen skin around the vagina and vulva, maybe a change in the amount of vaginal discharge. As we said before, a change in the color of the vaginal discharge and amount and the consistency. Maybe also applied with UTIs, so we can get pain or burning during urination. Maybe get symptoms like pain during intercourse, vaginal intercourse, and sometimes maybe get bleeding or spotting.
In this section, we will have different vaginal infections separately. So, what main cause for yeast infection?
Yeast infection is one of the two non-sexually transmitted disease. Fungus called the Candida albicans is responsible for most vaginal yeast infection. To know that the vagina have a balanced mix of yeast, including Candida and bacteria. Bacteria called lactobacillus act to prevent overgrowth of yeast. But if this balance disturbed, there is overgrowth of Candida or penetration of the fungus into deeper vagina cell layer will cause signs and symptoms of yeast infection. Overgrowth of yeast can result from antibiotic use, which may cause imbalance in nature of bacterial flora in the vagina, pregnancy, anchored to diabetes, and impaired immune system. Taking also oral contraceptive or hormonal therapy can cause increased estrogen level, maybe disturb this balance also. We can say also that Candida albicans is the most common type of fungus. I think that is all about yeast infection in general.
So, Dr. Mohamed, now it's time to ask about what's the main cause for bacterial vaginosis.
As we said before, there is balance between normal bacterial flora and fungi in the vagina. So it happens when natural bacterial levels is out of balance. Balanced level of bacteria helps the vagina healthy, but when it comes too much of some bacteria to cross, it can lead to bacterial vaginosis. It can happen at any age, but it's most common during reproductive years. Change of hormones during this time make it easier for some kinds of bacteria to grow. Also, it's more common among those who are sexually active. It's not clear why this is, but activities such as unprotected sex and douching rise the risk of having bacterial vaginosis.
How can we differentiate between bacterial vaginosis and yeast infection?
Yeast infection, we can differentiate it by type of discharge. It's thick, white, cheesy. But bacterial vaginosis, the charge is white, gray, or yellow. The symptoms, which is landmark in bacterial vaginosis, is the fishy odor. There is also other symptoms in yeast infection, like swelling, pain around the vulva, itching, painful sexual intercourse. Also in bacterial vaginosis, there are other symptoms, also like itching, burning, sometimes redness and swelling of the vagina and the vulva.
Okay, and in this section we will have in detail the management of vaginal infection. So, Dr. Mohamed, if you can explain us common options or common strategies for management different types of vaginal infection.
Yeast infection, the most common way to treat yeast infection is with over-the-counter of antifungal creams, ointment, or suppository, like metronidazole. Treatment can take from 1 to 7 days. Maybe also we can prescribe oral antifungal medication like fluconazole, deflocaine. If the women are pregnant, it's safer to use cream or suppository and avoid oral medication. In bacterial vaginosis, we usually start by a regimen of bacterial antibiotic. We can use some regimen like metronidazole, okay, which is pills, 500 milligrams, twice per day for 7 days, or we can start with gel 5 gram inserted in the vagina once per day for 5 days. We also can use the clindamycin, which is the form of pills, 300 milligram, orally twice per day for 7 days, or in the form of cream, 5 gram, inserted also in the vagina at the time for 7 days. Or we can use the ovule suppositories, which is medication membranes that melt inside the vagina, in dose of 100 milligram at bedtime, inserted in the vagina for 3 days. There is also tinidazole, may be used in other regimen also.
Now it's time to give more details about what are the lifestyle practices they may collaborate in vaginal health.
Okay, we can do some lifestyle practice for women to protect her from vaginal infection. Yeah. Some of them is like wearing cotton underwear, changing out of tight or sweaty clothes, keep her skin dry, avoid douche, like in Egypt, a lot of douche, vaginal douche. Weaving carefully. We start from front to back to avoid spreading of germs. Use skin-free pads. Use water-based sexual lubricants if they have used lubricant. In diabetes women, we must keep her blood sugar in check always. I think that's all for this lifestyle.
Are there any advices, especially for women that experiencing recurrent vaginal infection?
Okay, to know recurrent bacterial vaginosis is common. Despite of the treatment, infection recur in more than 50% of causes within 6 months to 1 year. The reason of this recurrence and high recurrence is clearly unknown. Research divided whether recurrence can be caused by the infection from partner during sex. CDC say that also bacteria associated with bacterial vaginosis can be found on male genitalia. Treating male sex partner has not helped prevent recurrence of bacterial vaginosis in all. There is also other causes of recurrence, maybe including the antibiotic resistance, maybe incomplete or unsuccessful treatment, imbalances in the vaginal microbiome. So, if bacterial vaginosis symptoms recur after treatment, everyone must visit the healthcare professional to consider alternative treatments. Options include different or extended drug therapies or supplementation to restore normal flora. balance in the vaginal microbiome.
Okay, thank you so much, Dr. Mohamed Adel, for giving us a valuable insight. Hopefully to meet you in another episode. Thank you so much for being on my side today.
Thank you, Diana.
Thank you.